All right. Good afternoon, everybody. Thank you for joining us for this Utah LGBTQ Chamber of Commerce sponsored Lunch and Learn with the University of Utah Health and Layton Construction. Sherelle, Raymore, and Lemur are going to be presenting to us this morning, or this afternoon, excuse me, this afternoon on so the Diversity, Equity, and Inclusion Initiative is going on. At their organizations, specifically around how to do good bidding, to do a good response to an RFP or put in a bid to do business with University Health and Layton Construction. Before we get started, before I pass it off to our presenters, if y'all would just take one moment just to introduce yourselves, I'll start and then pick on the next person. My name is Liz Pitts. I'm the president of the Utah LGBTQ Plus Chamber of Commerce. My pronouns are she, they. And thanks for joining us today. Rachel, would you go ahead and introduce yourself?
I am Rachel O'Crowley with Case Construction and Roofing, and I don't know what else to let you know about. That pretty much says it all.
That'll be good for now. And then Ed, how about you? Go next, if you will.
Sure. Ed Turner, a new member of the board of directors for the chamber. I'm happy to be here.
And Mikey, if I know you're sitting in your office right now, so if you can't speak, that's okay. But if you can.
No, I can. Good afternoon, everybody. I'm Mikey Reynolds. I'm the vice chair for the Utah LGBTQ Chamber of Commerce and have a little bit of laryngitis today, so hopefully you can hear me. And I also work full-time for Zions Bank Corporation as the manager of operations compliance. So happy to be here.
Thank you. So yeah, Lemur, Raymore, Sherelle, whichever one of you would like to start first, please go right ahead. And thanks again so much for putting this together for us today.
Sure, no problem. I'll just start since Lemur and Sherelle was just sitting there. My name is Raymore Clark, and I am the supplier diversity manager at Layton Construction. I cover the National Building Group and the ICS section or segment of the company. I report to Sherelle, and I don't know if that's a segue into her or Lemur wants to jump in. Either way, that's who I am.
Perfect. Good afternoon, everyone. I am Sherelle Cortez with Layton Construction. I'm the Vice President of Trade Partner Supplier Diversity. I'm super excited to be here to talk a little bit about our program and some of our initiatives we currently have going on.
Perfect. And I'm Lemur Montoya. I am the contracts manager for the hospital at the University of Utah. And I work all across the board within the hospital system on ensuring both compliance with our vendors, but then also, onboarding new members and working within our programs to ensure that, we are getting the best pricing, we're getting the best partnerships, and we're working and engaging within the community. And I don't know, I'm happy to go ahead and start and go through my presentation. So let me share my screen. And let me see if you guys, can everyone see that? Okay, perfect. So as I mentioned, I am from University of Utah Health. And let me, how do I go to the next? There we go. So I represent the hospital side of the university. I think that's a main factor to kind of point out at the beginning. The university is really split up into two organizations or entities, although we all fall under the umbrella of the University of Utah. There are two very separate sides. There's the campus and research side, and then there's the health side, so the hospital side, patient care side, and that's the side I represent. And so the purpose, obviously, of the hospital, of the University of Utah Health system, is to serve the community and to provide the best care for our patients in the community. And as such, one of the nuances that the university as a whole faces, and including the hospital side, is that we are a public entity. So not only are we charged with patient care and with ensuring that we're providing the best care for our patients, but we are also responsible for being fiscally responsible for any money that comes through our system and any of our structures and organizations. And so with that, we have to follow the Utah Procurement Code. And that really dictates how we conduct business with vendors. And so there are certain statutes that, say on how we are to award contracts, how we're to conduct solicitations, how long even we're able to have contracts with a vendor. And so part of my role, and I work in unison with the buyers here, is to make sure that we are following that procurement code and that we're, following the guidance that they give us. And so one of the items that really is applicable to anyone really that wants to do business with the hospital is the dollar limits that we have here within the procurement code. So it states there's 3 limits that we really look at when it comes to doing business. The first one is $10,000, and that's what we call the small dollar threshold. And so anything under that threshold, we aren't required to do a solicitation. We're able to kind of just do our own market research, work with the department, and kind of determine who the best vendor would be for that purchase or for that solicitation. And so anything under that, usually it's kind of the department's kind of looking and working directly with the vendors that they know and trying to find, themselves who they can work with. And in our organization on the hospital side, that doesn't happen as much, just because obviously, we have a very specific set of items that we purchase, within the hospital, and anything under that really kind of falls into the general supplies that we have contracts for. But there are instances, when we're purchasing like items to give away, like pens and pencils and anything like that, a department might be doing some sort of event that we would go to a vendor and be under that limit. And then the next limit is the $50,000 limit. And that's really where I'm going to kind of spend my time talking about, is because that's when $50,000 is when we are required to do a public solicitation. And so that's really the limit where anyone is able to come in and participate and try and bid on a contract or solicitation that we have available.
Campus kind of endeavor, but I thought the cabinet guys are already.
Oh, okay, perfect. And so that's what I wanted to kind of focus on, is just how to find those public solicitations and where and how to register and bid for those. That way you are aware of those opportunities that come, and those opportunities come in any sort of market or sector or any business that you might be conducting. I mean, they could be very hospital, healthcare specific, where we might be looking for a specific type of equipment, and for the OR or something like that. But again, with our kind of size, we really do anything from like catering, landscaping, marketing, promotional items. I mean, we really are in any sort of sector. And so the opportunities really can be for any sort of business. So the platform that we use is Periscope 2Gs, and this is the website. And I'll provide this to Liz, and we can distribute this presentation as well, so you have that direct link. But this is the platform that we use. This has a free portal that you can use to access our bids. And so when you're looking to participate and looking to register, you'll want to click on that try for free button that I tried to highlight there. And you would just register your new account. You'll want to make sure that you select government agency so that you can view our bid. And then once you are in there, you will notice, and once you're registered, you're logged in. I mean, it's pretty simple registration, and you're logged in. You'll notice that all of our solicitations that are currently available are up there. And so, and you'll notice it's not only just hospital, this is also applicable for the campus side and the research side of the university. Like you'll see on that screenshot I have there. And anything for University of Utah is free to access and to view and to respond. Any of the ones that are blurred out are not, for whatever reason, they're tied to us, but they're not from any of our offices. They're not University of Utah bids. And so you don't need to pay to view. I mean, you would need to pay to view those, but they're not coming from us. They're from different organizations. And so you're not required to pay to view any of our stuff. And so once you were to click in one, you would want to click, it's a little confusing, but you'd want to click in this button that says see original bid opportunity. So you could view the details, you could view the RFP documents, you could view any of the requirements that we're asking for in that solicitation. And once you click on there, it'll take you to this page. And like I said, from here, you can download the bid document. You can view the documents that are attached to it. You can ask questions and view all the questions that have already been asked and responded to. You can see if there's a pre-bid conference. Normally that happens for pretty kind of high profile solicitations or solicitations that require a walkthrough. Like let's say if we're doing some sort of janitorial services, we would want the vendors that are applying to it to come on site and be able to see, you know, the locations that we need those services for. And so you would be able to see all of those details here. And then once you scroll down, you could see if we've made any amendments to the solicitation, and then you would be able to click on place offer there, that button. And that would take you for the opportunity to essentially upload your documents for your response to that RFP or that bid or whatever the case might be. And when you are doing that, some really important things to note. One is to note who the buyer is. All of our solicitations will have the buyer, they'll have their email, they'll have their phone number. And so if you have any specific questions, they're kind of your go-to person on that solicitation. So you'll want to make sure you know who that is. And if you have questions and follow-ups, you can go to them. And then secondly, you'll want to notice how the solicitation is requesting for the response to be formatted. So, you know, it could differ. If it's just a bid, we could maybe just have some documents where we fill out the pricing and you upload that. If it's an RFP, it's going to require a much more in-depth response. And so we're going to ask for certain things like potentially examples or designs, or we want you to provide any references or anything like that. So make sure you're reading through those documents and really noticing what we're asking for and then responding accordingly. Because if your response does not cover everything that we've required, then we won't be able to consider it for selection. It would actually get thrown out because it'd be considered an incomplete response. And so again, if you have any questions on the solicitation, you'll want to just reach out to the buyer just to get that clarity of what, you know, if you're confused about what's needed or how to format it, they're your best resource for that specific solicitation. And then so that's kind of, again, pretty big overview of our how to register, how to bid for our solicitations. Again, each one will be slightly different and will require different things depending on what we're asking for. So your best contact for each of those, obviously, again, is the buyer. I also wanted to make note that, again, I represent the hospital side. So there's the entire completely different side, which is the campus side. And I just wanted to include a link to their webpage as well, just so that you have that and you have, excuse me, that's me. You have their contact information, and in case you have a solicitation that you're wondering for them, or you have an opportunity that you want to talk to the campus side, the education side about. And within there, there's also their contact information. They actually have, I want to say, about like 10 different buyers. So this list isn't complete, but if you go to the webpage right here and you go to contact us, it'll give you the link to this page where you can see all of their buyers, and it'll tell you which responsibilities, like which market they're in, each buyer handles. And so you can then contact the appropriate buyer for whatever, segment you're in. And so obviously, like if you are a consultant, you would want to contact Trent Blair for those opportunities and those solicitations. And that is really my presentation. Again, just an overview of how we conduct business. I have listed both my phone number, my email here, and then also just a general email for the hospital for supply chain and purchasing for the hospital. So if you are trying to find an opportunity, you're not quite sure who to reach out to, that main email is good because then it'll get filtered to the correct buyer or the correct contact for that opportunity. And I don't know, Sherelle, if I'm happy to answer questions now, or if we want to move on to the next part and then answer questions all together at the end.
Liz, I guess while it's fresh, I probably would turn it over to the audience for questions.
Okay, perfect. Yeah, are there any questions I can answer about the hospital and our processes?
I do. I have a question to start with, Lemur. You were talking about for like the small dollar amount purchases under $10,000, you don't go through a bids and proposals kind of process. You can just do your own research and such.
Yep.
Kind of coming around to this question, if we have a business who's interested in doing business with the university, does it make sense to set up an account in your bid system, even if there's not an active bid that they're bidding on? Is that a place you would go to look for vendors during your research process?
Yep. So you could certainly set up an account, and that will do two things. That would get you kind of in our purview as far as like who's out there in case we're looking for something and we don't have prior vendors that we've worked with. And then two, it would get you, you can actually sign up for email notifications based on your type of business. And then you would get notified on those opportunities when those opportunities come up. And so that's a good kind of place to start. Again, that is for that kind of higher dollar type of solicitation or opportunity. For anything under that, what is really the most effective is to start networking within the departments. Because like I said, under those kind of limits, the departments really have a lot of flexibility to select and work with the vendors that either they're familiar with, or vendors that they've kind of done their research and feel that they're the best fit for that project or that purchase. And so you could do that many ways. One way is we do have our directory is open, and you're welcome to kind of like look through there and send introductory emails. You could send some information to this main email for hospital purchasing. And what that would do is, kind of introduce yourself, your business, and then that would get forwarded to the appropriate buyer so that they can kind of review and then reach back out to you and, kind of get you on the radar. For the campus side, again, on that web page, you would have each of the buyers contacts. And so for campus, you could actually reach out directly to those buyers, depending on what, type of business you are, and kind of introduce your organization and your business and kind of get your foot in that way. So that's what I would recommend, is definitely networking. And then obviously, if there are any networking opportunities that you see, I know the state does some where it's like reverse, like trade shows where like we sit on, and the vendors come and talk to us. And so, registering and looking for those opportunities for their straight as well is a good way to kind of get your business introduced to our organization and get your foot in the door.
Okay, thank you. Appreciate that.
I guess I have a question too, just thinking from a vendor perspective. If I'm bidding for the first time and the bid is incomplete and it's thrown out, is there a notification process to provide like additional training so the vendor can, make sure the next time around that they submit a complete bid?
Yeah, so we don't have a formalized process for that. However, once the bid is awarded, the vendors would get notified of who was selected, and then also if your bid was incomplete, you would be notified of that. And so that at that point what I would suggest is to reach out to the buyer and, you know, kind of ask for a debrief session with them of like, hey, what happened? You know, is there a reason why it was rejected? Was it based on price? Was it based on other factors? And then kind of go from there. I know when I was a buyer, that, you know, that was something I consistently did, was after solicitations, I would hold debriefs with the vendors. Generally with the vendors that requested it, but especially in higher profile solicitations, I would do a debrief with all of them just to kind of explain why the award went the way it went, and you know, kind of provide them that training and that background. So definitely, if you bid and, you know, you're either not awarded or, you know, your bid is incomplete and you're notified of that, I would reach back out to the buyer and kind of request a debrief and, you know, go through that so that you can get that training, because they'll provide that to you at that point.
Is there specific insurance requirements that you guys require, or like health requirements, any of those things?
Yeah, so insurance, especially when it comes to if you're going to be on site, there are specific insurance requirements. So like, let's say we have a solicitation for services that require you to come on site. There would be specific insurance requirements, and that would be listed on the solicitation. And it's the same for, you know, there's some solicitations where we require like a vendor to have certain licenses or certain, you know, experience in a certain case. I know it's in particular for like janitorial services, we require, you know, because we do deal with like biohazard materials and sort of, and, you know, items like that. When we do janitorial services as a solicitation, there are pretty stringent requirements that, you know, a business that normally just does janitorial services for an office space, you know, generally does not meet, because we do have kind of that higher level that we need to meet. And so the bid packet and that solicitation, that's where you'll find all of that. And again, if you have questions about that, that's when I would reach out to the buyer and kind of inquire about anything additional that, you know, is maybe not included in there, or that you want further information about.
Thanks.
And then I have one more question. Again,
Yeah.
I'm putting my hat on as if I was a vendor.
Perfect.
Thinking about pay terms, how is that structured for the hospital in regards to paying diverse small businesses? Is it 30 days, 60 day? Can you provide any information on that?
Yeah, our general invoicing terms are net 30. So that's, you know, 30 days from the date we receive the invoice is when we pay. We certainly work with vendors on different payment terms as well. I know, you know, any of the payment terms that you could think of, I know that, you know, I'm sure we've done and we work with generally. And that's just a matter of when let's say you've been awarded a solicitation or a contract, of working with the buyer or working with the department on that contract and making sure that those terms that you're wanting are included or negotiated within that context. The one thing that is difficult for the university is to do prepayments. That's actually part of a statute from the procurement code. It doesn't come from us, it comes from the state, that the general rule is that we do not prepay for anything. However, there's a lot of businesses where that's the case, and we have exceptions and we work through those exceptions. But as far as like a general rule of thumb, that is something that we don't do. And if it's required for whatever reason, we would just need to go through an exceptions process for that.
And then I have one more, if no one has any other questions. My last question is in regards to bids that are going out. Does the university have like a stated goal for diversity that you're trying to aim for with getting like minority, LGBTQ, women, veteran participation? Do you all have a stated goal that you aim for inclusion?
That's a great question. I actually am not aware of us having like an actual stated goal of working with like minority and, businesses. However, it is something that we are like aware of and working towards and wanting to improve, certainly. And this is, kind of the reason why we do these outreaches, to try and get more of that within, and especially within our community, right? Like local businesses and community where we want to support as well, besides just providing healthcare services, but also providing, financial and economic services as well within the community. We work with several organizations like the HA Network, which is the Health Anchor Network for, it's a national network that we work with. And there are goals integrated within that of working with minority business, working with local business and stuff like that. But we, as far as I'm aware, we don't have a mandate, like let's say a federal organization or federal institution does, where they actually do have federally mandated requirements that they have to meet. The state doesn't impose those on us, but it's something that we certainly look at and want to work with and always improve.
And the reason why I ask that is really to, when we present, we'll really talk about our partnership with the university and how we as a company, Layton and the university, came up with a MWBE goal that we are wanting to get inclusion, have that local economic impact in the community. So it is important, but we could talk a little bit more about that in our presentation. So great partnership.
Yes, and that's, I mean, I would say that's one of our strengths, is working with, whether it's formal organizations that specialize in that, or working with our vendors and our partners like Layton Construction, and trying to get those goals to maximize those goals in our area. So yeah, that's a great point. So yeah, unless there's any other questions for me, like I mentioned, I'm always happy to jump on a call, respond to any questions. So feel free to contact me. But other than that, thanks for the opportunity to present, and I'll turn over the time to Sherelle and Raymore.
Thank you, Laymer. I will turn it over to Raymore. He will kick off our presentation.
Can you all see my screen? Okay, fantastic. All right, I just want to start out by thanking Liz and Riley for having us here, being able to present to you guys today about, we'll talk a little bit about how Layton does their work and how you can bid. We'll also talk about the diversity, not necessarily in that order, and the different certifications that we actually take in order for us to qualify and quantify the amount of diversity that we have on our projects. I will start out with the team, and this is a team in Layton. We actually are doing some partnership, as Sherelle and Laymer mentioned, with the University of Utah Health. So Trent is the vice president who will actually, he leads the pre-con department, and Sarah that you see there is the estimating assistant. They work closely, and they couldn't be on this call today, but I wanted to take a brief moment to introduce them and let you guys know some of the partners that are actually there in Utah. Secondly, I wanted to, since I've introduced myself earlier, I'll pass it over to Sherelle to introduce herself. Go ahead, Sherelle.
Thank you. Well, good afternoon again. I'm Cheryl Cortez with Layton Construction. I've been on board. It will be 2 years next month, but I have 18 years of experience in the construction industry. Our supplier diversity program is fairly new. So again, I've been with the company a little under 2 years. That's how long our program has been in existence. My previous background, worked for a large general contractor, ran their supplier diversity program regionally in the Southeast. I've trained over 400 diverse business owners on various topics for growth. So I'm excited to be here. We're always looking to grow our pipeline to meet more new diverse businesses that can work with Layton as a partner. Thank you.
Thank you, Cheryl. I'm gonna ask for a moment here. Something got my attention. Excuse me 1 second.
Okay, I guess we're on pause for just a moment.
Yes, we're on
here.
pause, but I can continue to speak. So our supplier diversity team is made up of 6 employees. We have 3 total diversity and inclusion managers, and how we're broken out is really by business unit. As Raymond explained earlier, he's over NBG, ICS, and CSG. We have Quentin O'Neill. He's a supplier diversity manager as well. He's over all of our healthcare projects and mission critical. And Teresa Choi, she is out of Seattle, and she covers Northern Cal, Southern Cal, but really she's involved with every market sector in that market. We also have a diversity specialist that really focuses and helps us with all of our outreach events. We are operating in 48 states, so she's responsible for helping us with market research. We really find out what is the availability in each market when we're doing business, and that's how we really hone in on the diverse population and host outreach events. And then we have a tracking specialist on the team, Trisha DePello. She's responsible for all of our tracking. Every project that we have, we do track our diversity spend and report to our clients. And that way we can also measure and track the success of our projects. I will turn it back over to Ray Moore.
Thank you, Cheryl. I apologize about that. Everyone, my 10-year-old came in and had an emergency, so I had to address that. So I apologize. A little bit about Layton. We've been around since 1953, which is, I think next month we celebrate 70 years in business, and we are a $4 billion revenue company. We from a segment breakdown standpoint, we do 1.6 billion last year in the industrial area and about $1 billion in the healthcare. We're the 4th largest CMAR contractor in the country and the 7th largest healthcare contractor in the country. We are headquartered there in Utah, and we actually we have 12 offices throughout the country, strategically placed. However, we do work in pretty much 48 states throughout the country, and they're listed here from Salt Lake to Liu in, I think I pronounced that right, Liu in Hawaii. We have certain expertise whenever at Layton. We've done everything from data centers, industrial parks, healthcare. So some of the areas of our expertise are the CSG area, which is our construction services group, where it's public, higher education, sports, offices, industrial, and correctional facilities. Our interior construction specialists, ICS, they specialize in tenant improvements and performing arts and correction facilities as well. The Layton Construction Arizona, their area of expertise is office and industrial, hospitality, mixed use, tenant improvements, or HCG, Healthcare Construction Group. Their specialty is healthcare, which covers, it speaks for itself. The National Building Group, like I mentioned earlier, warehouse, the industrial, distribution, manufacturing, those are some of our areas of expertise. In Layton, Hawaii, we do the hospital, a lot of the resorts there, higher education, and office mixed-use buildings. And Layton in Southern California, we specialize in the hospitality area of it, the office, retail, the mixed use, and higher education as well. So those are just some of the areas of expertise that we have. Diversity is important to Layton. It's a top priority, and making sure that people on our projects, companies, subcontractors who are participating in our projects are diverse. And at the top of that, honesty, safety, unity, and quality is extremely important, because on the project sites, the subcontractors are not just representing themselves, they're representing Layton. And with this is our mantra, so to speak, where honesty and safety and unity and quality is concerned. It's something that we value at the top of our list. So we expect our subcontractors who participate on our job express this and actually embody this information that our mantra that we actually use on our projects. Something that we're really proud of, we recently launched our Layton Trade Partner Equity Program, which is an educational program for subcontractors that want to participate on a project with Layton, where we actually we teach them how Layton does stuff, from how they bid, how they should look at our contracts, how we also provide information on their business, because a lot of small businesses, they have their business but not necessarily know a lot about managing their business. Well, we provide information in that sense that will help them to improve their business from that standpoint, as well as how they can partner with Layton. There are other initiatives that we provide as well. The quarterly subcontractor meeting, where we meet with subcontractors, making sure that they are they have everything that they need. They understand what Layton is looking for in participation on our projects. Partnering meetings where we partner them with the first tier to make sure that they understand what the first tiers are looking for, and trying to and how they can actually partner. So the main goal of this is to break down barriers. The main goal of our Layton Trade Partner Equity Program is to break down barriers and make sure that there's nothing that's preventing a subcontractor from partnering or participating on a project for Layton. We provide pre-qualification workshops within that, or TPEP is what we call it, the Layton Trade Partner Equity Program. We help people understand how they can qualify for our project as well. When I say people, I mean subcontractors and trade partners. So these are just a high view of what it is that we provide under this program. In Utah, we actually started off last year in October, where we currently have about 8 participants, trade partners, who are currently participating on the projects here. At Layton, not participating on the project, but actually being a part of the program. And it's a 7-month program that will definitely, at the end of it, they will definitely understand how they can actually do business with Layton. So that's one of the main things that this program offers, and it's actually going to be an annual thing. So we're looking to do this on an annual basis. The certifications that we accept are they're labeled here, the MBE, WBE, DBE, SBA, the veteran, and the LGBTQ plus certifications. One of the main things is whenever you're actually bidding on a project or trying to participate on our projects, we want you to upload the certification so that we know that you actually are a minority group and are looking to participate on our project. At this point, what I'll turn this over to Sherelle.
Yes, so we're all here to learn how to do business with Layton, right? And our pre-qualification process is a big component of that. Our pre-qualification process is not to disqualify anyone from doing business with us, but it's really to find the right size opportunities for each business. So we require that all of our subcontractors, vendors, and suppliers complete our pre-qualification process. It is a part of our risk management program, and each subcontractor doing business with Layton will be required to complete our pre-qual. Again, as Raymore mentioned earlier, our goal as a supplier diversity team and as a company is really to eliminate barriers, meeting people where they are. So if you have any questions or you stumble across something when it comes to pre-qualification, we don't want you to quit and say, oh, I'm not going to do business with Layton. We are here to help you get through the process. You can visit our website, laytonconstruction.com, to complete our online pre-qualification. We do have dedicated resources to help out with the process. These are, if you look over to this box section where it says documentation needed, these are the documents that we need. If you have this information on hand, it's going to be very simple, easy for you to get through our pre-qualification. Earlier mentioned, as you sign up to get pre-qualified, if you mark that you are a diverse business, we do want you to upload your certification indicating, validating that you are a certified business. Next slide. Next. Okay, there we go. So within our pre-qualification, after you get pre-qualified, we do have bidding steps that are included. So this is really coming from our pre-construction team. So once you get pre-qualified, there's a bidder qualification form that needs to be completed prior to submitting your bid. There's going to be plans and documents, and I'll talk about this in the next slide. We use Building Connected to issue all of our invitations to bid. So if you don't receive any documents, we are happy to provide you access to Building Connected. And that is a free service where you can access the documents. And then again, we keep reiterating on if you're claiming a minority status, that we really need you to upload that certificate, because our owners are looking for us to validate, making sure that we are compliant. As you get on a project with us, we report monthly, quarterly spend to our clients. And we're responsible for making sure that the certifications are not outdated. So if you are diverse and you have a certification, we do require you to upload that information. Next slide. So I talked about Building Connected, and I know, Rachel, you're in the construction industry. I'm not sure if you're familiar with Building Connected, but that is the software that we currently use to issue all of our invitations to bid. So you'll have your bidding documents, any addendums or anything coming out, that will come through Building Connected. Each subcontractor is responsible for setting up their own account. Building Connected has made some changes where if I go in the system and set myself up as a MBE woman-owned business, I am required to upload my certification as well. This is going to be a huge help to our pre-construction department. As we're putting our bid list together, it's showing us what is our participation coming in at. So this is a huge step with Building Connected, adding this component to their database. So some of our projects do have NDAs. If a project that we're pursuing and you're bidding with us has an NDA, you'll be required to sign that document before we release the bidding documents to you. Next slide. As a part of our commitment to diversity, equity, and inclusion, we work hand in hand with the pre-construction department. There is a folder that we use, it's Small Business Development Program, and we require all of our first tier trade partners to let us know if they're using any lower tier participation. So we do have a utilization form that we do require our first tier subcontractors to complete. And again, we are looking to provide economic impact. We're looking to grow lower tiers that may not be able to partner and do business with Layton on a first tier level. So we want our first tiers to share in our same commitment to diversity, equity, and inclusion. So we do have that utilization form that we do ask them to fill out, give us an idea on who they plan on using as lower tiers. So we ask for that information up front, and we do track and monitor that information throughout the life of the project. Next slide. And this is what it looks like. Oh, I'm sorry. Those boxes, it's really what it looks like when you click on subcontractor bid form. You now can see the form diversity and inclusion. From there, that's where our pilot program is, where we are capturing the information of our lower tier spend. Next slide. Earlier, we talked about our commitment with U of U. We have a large project. We will not have an outreach event, probably maybe fourth quarter into first quarter. We are not there yet with all of the bid packages and things like that, but we did commit to a 10% small women, minority, veteran goal. So we are actively looking to engage with diverse businesses to participate on that local project in Utah. Raymore and myself are the point of contacts. Again, we'll be hosting several community outreach events, engaging with Riley and Lemur. Lemur's actually been to a couple of our sessions and giving presentations. So if you are interested in participating on that project, please notify Raymore or myself. And you'll also see more communications in regards to that project and others. We don't want to limit you to one project with us, but we have a ton of projects going on right there in Salt Lake City. If you need some help getting pre-qualified with us, please let us know. We'll help you get through the process or connect you with some of our subject matter experts. And I'll turn it back over to Raymore.
Well, thank you, Cheryl, for wrapping this up for us. At this point, we'll take any question that you guys may have.
On that project that you have for the U, I saw that on the government site when they were doing the bids, and they required every employee to have healthcare insurance, but I don't have more than 50 employees. So what is your requirement on that?
I don't know if you want to take that one on, Cheryl. From a healthcare insurance standpoint, I am not 100% sure what the requirements there.
Yes, I don't have that information either. And I think Riley has hopped off. I don't know if Lemur can help with that. Either I don't have a response to that, but we can find out. We can connect with Trent, our Vice President of Pre-Construction, and get that information over to you.
Okay.
Rachel, would you be willing to just put your email address into the chat potentially? And then
Yeah.
somebody would take the lead on following up. That would be really wonderful. I have just a comment, something to add to the conversation, not really a question at this point. Once again, thanks. It's so important that really large companies like Layton and large organizations like the U do have these supplier diversity initiatives. And for those of you who are on this call or potentially watching the recording later, if you're LGBT owned business, at least 51% LGBT owned business, the certifying body for LGBT businesses here in the country is the NGLCC, the National National LGBT Chamber of Commerce. And one really wonderful thing is that because the Utah LGBTQ plus Chamber is an affiliate of NGLCC, if you join the chamber or you're already a member of this chamber, the certification fees are waived for you. So if anybody is interested in becoming certified, you can join our chamber for as little as $150 a year. And the certification itself is a $400 value each year. So I just wanted to put in a plug for the chamber. So if you want more information about becoming certified as what they call an LGBTBE, which is business enterprise, then I'm happy to get you started or walk you through that process.
That's awesome. That's good information right there. People are always
Yes.
looking for ways to get certified.
I would like you guys to reach out to me about your program as well, the 7-month program thing. I would like to be involved in that.
Absolutely. Be more than happy to.
Thank you.
Liz, will you be sharing this PowerPoint presentation or providing all 3 of our contact information to the chamber and the participants?
Yeah, I can do that. I was actually hoping to just put the whole recording up as well. So yes, I'll do that. And if you send me over the slides, it may be easier for me to share different formats in different venues. So I would be more than happy to. Yeah.
Awesome. Thank you.
And thanks, Mikey, for the comment there. I just wanted to thank everybody. We've got about 2 more minutes left in our hour if anyone has a last minute question. If not, thank you all for taking the time to do this today, and hopefully we've made some good connections here.
Thanks everybody for being here. This was super nice.
Thank you.
Thank you. Glad to
Thank
be
you
here.
for your time.
Thank you
All
all.
right. Cheers. Have a great afternoon, everyone.
Thank you. Thanks for having
Bye.
us again.